Okay, this video is called What is the New Miracle Marketing System for MS and Dementia Prevention Drugs? Well, I was reading a brain MRI and the patient had a diagnosis of dementia, a special type called cerebral amyloid angiopathy. It's abbreviated CAA. So amyloid angiopathy is when there's a bunch of small bleeds in the brain. They call them cerebral microbleeds, CMBs, little black spots, and it's from hemosiderin. It's a breakdown product the hemoglobin from bleeding. So anyways, I noticed that this patient the follow-up study showed the brain was looking better and better. There were much fewer lesions, much fewer microbleeds, and I had never seen them regress before. So I thought about it a while, these cerebral microbleeds, CMBs, and I pondered it, and then I realized what was happening was the old MRI had been on a top-notch 3 Tesla magnet. The higher the number of Tesla, that's the magnetic field power strength, the more sensitive it is for detection of microbleeds. A little bit of iron in there, which distorts the magnetic field. So a high power magnet is more sensitive. Whereas the follow-up scan was done on a routine 1.5 Tesla magnet. So you're always going to detect more of these microbleeds when there's little small ones on the 3 Tesla magnet. It's more sensitive for detection of those small microbleeds. So I thought to myself, we could use this to test any drug for the treatment of multiple sclerosis or dementia prevention, especially with regard to amyloid angiopathy, but also for microstrokes like with typical, ischemic small vessel cerebrovascular atherosclerotic disease that is shown on an MRI as a bunch of bright spots. They used to call them UBOs, unidentified bright spots. We typically call them now the flare sequence, so we call them hyperintense, means bright. So flare, periventricular flare hyperintensities. Anyways, the bottom line is the worse the magnet, the fewer lesions are detected that show up on the scan. So all we have to do to market any drug for multiple sclerosis or dementia prevention of strokes or microbleeds is we'll just scan the patient the first time on a 3 Tesla, or better yet, we'll take them to a university center and scan them on a 7 Tesla research magnet that'll show tons of lesions. Then we'll give our miracle drug, whatever it is, and then we'll do the follow-up on an even lousier magnet. We'll get a 1 Tesla magnet. We'll take them to a shopping mall where it's open, it's poorly shielded, and we'll see far fewer lesions. We're going to make billions of dollars. This is great. I can't wait. We'll just declare it was due to the drug. I'd like to announce my retirement from clinical medicine. I'm going into drug marketing.